name is Ellie, and Ellie was almost 15 years of age, and she was diagnosed with a mass in her gallbladder called a mucocele. And this is kind of a rare thing. I'm starting to see more of it in the last couple of years, but it's not real common. And Ellie had, at almost 15, had, decreased her appetite a lot. She started vomiting, had some loose stools. And so when she went in for a diagnostic workup, X-rays and ultrasound, this is what she was diagnosed with. And basically told there's really nothing, it's an inoperable tumor. And you might as well just take her home and let her die peacefully.
Oh, that's always hard to hear.
Oh my gosh. And when I saw this Facebook post, I reached out to her, I just sent her a message and I said, I know you don't know me, but here I am in Iowa and I might be able to help you. I can't guarantee anything, but you know what? I wouldn't take that diagnosis and just run with it. And so she contacted me, we chatted, and then we set up a consultation and I helped her with nutritional supplements, getting her on the best diet we could possibly find for Ellie. And over the next few weeks, she started to turn around for the positive. And within a couple months, she had some energy. She was out playing again, put on more weight, and was doing very well. And Ellie just celebrated her 16th birthday. She's actually 16 and a half now. She celebrated her birthday earlier this spring. And,
Awesome.
and this pet parent posts pictures of her frequently and reaches out and says, this is, and she had a picture of Ellie in her birthday hat and it was so cute.
So
And
cute.
she's thrilled and I'm thrilled that she didn't give up, and I think that a lot of times people do take that terminal diagnosis and start to give up,
They don't know that there might even be another option. They
Exactly,
don't know where
especially,
to go when, but my vet said this, and then
right.
that's just what they take at heart.
Exactly. And a lot of people, are more aware of the alternative in
Mhm.
natural therapies now. Um, but sometimes, it's just like they are so hit with that diagnosis and that prognosis that they tend to lose hope.
Yeah, I think people just sort of freeze up and don't really know where to go next. And one of the things that I say is I think it's at least worth the phone call to somebody like you to see if there is anything to. I mean, I sent somebody to you just last week. I said, look, this is beyond my scope. I don't even know anything about this ailment. And she's like, I didn't know this was an option to even call somebody like you. So
Yeah, and I think I know who you are referring to, and she did buy a premium coaching package.
oh,
So I want to thank you for the referral.
my pleasure. Listen, for me, it's about how do we get these dogs help and get them to the right resource who can do those things. I can do a lot of things with nutrition and essential oils, but I can't do veterinary medicine. I wish I could. That's not my wheelhouse. So.
Didn't you at one time, Dana, want to go to vet school?
Um, I can't say yes,
Oh,
because I don't think I could ever really do all the surgical blood broken. I don't think I could do all of those things. So no, I never really pursued that. I have thought about doing like naturopathy school, but that's like 5 years, and I'm like, no, I'm happy doing what I'm doing. So
yeah, and I think you can make an impact with many people with the knowledge you have now, rather
right,
than having to take another specialty.
agreed, agreed. So that's awesome. So besides nutrition, did you add essential oils, homeopathic remedies? And I'm
All of
not
the
asking
above.
you to be specific, but just what were some of the modalities?
The modalities were, well, Ellie gets regular acupuncture and chiropractic treatment from her local vet, or local practitioner. And then I helped her with essential oils, high grade nutritional supplements, formulating a homemade diet for her. And then we did some homeopathic remedies. And some of these homeopathic remedies were really cool because they didn't have to be given orally. They could be applied topically and do the same thing.
Right.
So Yeah, and Dana, I don't branch out into 20 different modalities. I'm pretty
Right.
much, I've got my favorite things I use and I get really good at those favorites, and
Mm.
I know a lot of practitioners, will advertise that they do all these different things, and that's fine if they want to do that. But it's just, I want to fine tune on the things that resonate with me, and not all therapies resonate the same way. You know what I mean?
Right. Agreed. Totally understand.
Great.
Help people understand a little bit about like how chiropractic and acupuncture fit into this, because I think that's foreign to, I mean, we're talking about disease, and then acupuncture or chiro is more structural, but help us understand that bridge to those modalities.
Oh, that's $1 million question. It's very difficult. It's difficult to
Just a little
explain.
bit, right? Because I think
Um,
sometimes when you say go see a chiropractor or an acupuncturist, they're like, but why? Why do I
okay.
need that?
Yeah. Well, a chiropractor works on the nervous system, and if there are blockages or obstructions in the energy pathways that travel through the nervous tissue, then the chiropractor can recognize these and open those channels up. Same way with acupuncture, it also tends to work on the energetic channels in the body, but it's a little bit more challenging to describe. But I can use this analogy for acupuncture. So those of you out there who know what an electric fence is, if you have livestock or horses, it is a fence made out of a certain conductive material that is hooked up to what we call insulators. And then those insulators carry the charge through the wire into a big battery charged type of device. And basically what it does is it electrifies the fence so that if an animal touches it, they'll get a little bit of a shock or a big shock, and then they'll back off and not try to force through the fence. If one of those insulators doesn't work or it's broken, it falls off, whatever, then the whole electrical charge is kind of nil. I mean, it's just gone. And
Interrupt.
so if you have, and our bodies work in much the same ways. We have energy bundles in our body called chakras. And if that chakra is out of balance, or we have a nerve that is impinged or is just not allowing the energy flow, then acupuncture opens those channels up. So they're very much related, but yet so different.
Awesome. Yeah.
Mhm.
All right. Well, congratulations on Ellie. That's wonderful. I know her pet people are happy about
Oh, yeah.
that.
Oh, yeah.
A little dog, big dog.
Lab.
Oh, wow. At 16 now?
She's 16 and a half.
That's fantastic.
Yes, and given a grave prognosis.
Right.
So, yeah.
Yeah. And do we think that that's because the traditional vets don't understand these alternative modalities? They just don't know what else to do?
I think that's a big part of it, Dana. And the other thing is they'll look at an image and go, well, gosh, we can't operate. So, yeah. And then they're stuck because basically a lot of these, it's just like with the human doctors that they look at that and they really can't grasp, but there could be anything else. And I know that the human doctors are really, they have a gag order. They can only prescribe medicine or do surgery. That's all they can do. They can't say, hey, go see this acupuncturist, or go see this functional medicine doctor, or go see this naturopathic doctor. By law, they can't.
Right.
Now, that's not true in the veterinary field, but I think you hit the nail on the head when you said they just don't know about other things.
So do you find that any of them are ever collaborative with you? Like and maybe not this particular case, but what I run into a lot of times, and I just had a conversation with somebody on Facebook last week. They're like, oh no, never go to the traditional vet. Well, some of these folks don't have a holistic vet like you in their area, but we need the diagnostics, we need the labs,
Right.
we those things. So how can we help the pet parent bridge that collaboration?
Well, a lot of times I'll tell people, especially if the pet parent says, How I don't know if I can forward the records because I don't know how my vet's going to feel about you getting involved. And I say, here's the deal. They still get the money from the diagnostics, the yearly or semi-annual checkups. Any medicine that your dog absolutely needs is going to go through them. They're still going to be the primary care physician. I am just bridging the gaps. I am offering other things that can augment that animal's condition and not interfere with what they are doing. And most vets, when I ask for medical records, I would say 90% of the time I have no trouble getting the records.
Mhm.
Some balk at it, some I have gone nose to nose with on different things, especially with the vaccine issues. It just all depends on the practice and the severity of the condition. But for the most part, I think if pet parents just explain that, hey, I'm really glad that you're here to help me. This is to the traditional vet. And I just want to incorporate some other alternatives. And, I think that most vets would be fine with that. It's the way that you approach them. Praise that traditional vet for the services they're offering and know that they'll keep coming back to you or that you will keep going back to them. And we're just going to get a little bit of a bonus in here with our holistic practitioner.
Point of view, just an alternative way of
Mhm.
something, right?
Right,
I think most vets will understand the desperation that pet parents have with
right,
diagnosis like that, that just like, I'm going to try anything I can. And I
right,
please,
right,
please be part of it because we need your labs and diagnostics and medications, but be open to hearing from someone like you. So
correct.
that's
Yeah.
awesome. But I almost think in some cases we've gone a little too far in saying, nope, I'm never going to walk through the doors of a traditional vet practice. And I think that's pretty dangerous.
Well, and then with me, when I'm taking on clients and I'm doing telemedicine, so I'm not seeing the patient in person, I'm just watching videos, looking at pictures, talking on the phone with the pet parents. Um, I don't want to be having a Google diagnosis in front of me. In
Yeah.
other words, for one thing, I have certain laws that I have to abide by with telemedicine. I also have to have a definitive diagnosis so I know exactly what I'm looking at and not a presumptive diagnosis. So, yeah, and I always tell people if you suspect that your pet has this, please go get the proper testing done. Let me know what they come up with a diagnosis, then I can help you.
Right. Exactly. All right. Well, what's your next success story?
Well, I have another one. His name is Jack. This happened quite a few years ago. Jack is a Jack Russell Terrier. And Jack, every month or two, would go through about a 2 or 3 day stint where he didn't want to eat. He'd puke, have loose stools. And he's just a really sporadic eater. Didn't want, the twice a day feeding. Some days he'd go without eating at all. But there's just kind of a cyclic kind of thing where he was going through. So her regular vet was kind of like, well, we're not coming up with anything with the diagnostic testing, but we'll send you to Iowa State University and we'll have you see a GI specialist. So she spent, and this was probably 18 years ago, she spent close to $5,000 at Iowa State University. And they basically said, we don't know
Wow.
what's going on. And gave her homemade diet, which I commended them for. I thought that was way cool. And Jack got a little bit better, but he wasn't 100%. So it was a good friend of mine. I've been friends with her for 45 years, so I helped her without, a lot of, I'm not charging her. I'm just giving her some advice. And I said, there are a couple products that I think Jack would benefit by. And one was a really powerful intestinal support powder. And the other one was digestive enzyme and probiotic. And just the addition of those two things completely turned this dog around. He's now, I think, 15 or no, he'd have to be, I said that was 18 years ago. So probably 14 years ago is when I worked with her.
Wow.
And he's still alive, still doing well. She still has him on the same support powders that I suggested. She's never gone away from that. And he's a happy little old dog.
Yeah. If it ain't broke, don't fix it. Just stay the course.
Right. Right.
So,
Yeah.
what do you think in a situation like that? where diagnostics didn't show anything. What was driving that? Just
I think he had a nutritional deficiency of some kind, or he had a organ system that didn't respond until we added those support powders. And so oftentimes it doesn't take a lot. Sometimes it takes a lot, and sometimes it doesn't take a lot.
because that's a pretty simple answer is nutrition.
Yeah,
a couple
right.
times, and that's awesome. And I'm just, it's good that she didn't give up, that she just didn't go. Nobody knows. She kept
Right.
asking, what can we try next?
Yeah. And that brings me to another case, Dana, because this is a really, I still chuckle at this one all the time. Um, this is where well-meaning pet parents try everything under the sun and don't have any guidance, okay? So in other words, let's just take an example. Say I'm the pet parent. I get on the internet, I'm searching for my dog's scratching itself to death, and I'm searching all these things, omegas and quercetin and turmeric, I mean, everything, right? And then I try everything like and I call it the shotgun method, just
Right.
see what works, you know?
Yeah, absolutely.
And so when I still had a physical practice, I had a client that I had communicated with over Facebook, but I'd never met her in person. And she says, my dog Molly is scratching itself to death. She keeps me awake at night. In fact, I have to take 2 sleeping pills just to get enough sleep because she's constantly scratching.
Oh my.
Yeah, and so she had seen her traditional vet, and it was the typical type of protocol that vet put her on, which is steroids, antibiotics, and the prescription food for
Mhm.
allergies. And Molly would get way better and until her medication was done. And then it was back to the same old, same old. So I said, well, Carol, bring her in. You know, I have time tomorrow afternoon to look at her. So she brings her into my clinic. And I'm watching her walk across the street with Molly. So Molly's on a leash and Carol's got 2 heaping, and I mean heaping, shopping bags full of stuff. I'm like, what on earth is she bringing me? And she walks in, says hi. We greeted each other, and she takes her bags and dumps them on the exam table. And she goes, "This is what I'm doing for Molly." And I said, and she goes, "What do you think of these?" And I went, I'm looking at those products, Dana, and I'm like, I'm not familiar with any of them.
Oh wow.
And she'd probably spent $600 on these supplements, and Molly wasn't getting any better. So I said, here's the deal. I had that kind of like I had to get down to her heart. I said, what do you think? Because I don't know these products. I mean, it might say these products have these certain ingredients or specific milligrams of constituents in it, but I have no idea.
And
I
what
said,
else is in them? Because what else
yeah,
is in that product? Yeah.
right. And so I said, Carol, this is what I would do if Molly were my dog. And if you trust me, this is what is going to happen. We're taking away all of these supplements. And I said, you know, don't throw them away. You can keep them. We may revisit these someday, but for right now, just take her off of everything. And then I prescribed an omega-3 fatty acid supplement. The intestinal support powder that I mentioned was helpful for Jack because we know all allergies start with leaky gut, and we had to fix leaky gut first. I gave her a homemade diet, very simple 4-ingredient recipe for her to use, and then another support powder for the entire body. So it hit every organ system. And, you know, just we start and a few essential oils. I showed her how to make, you know, a roller bottle where she could just roll the oils onto Molly, not even have to drip them on her. She was a small dog, so we could make this roller bottle with just a few drops of each oil that I chose for her and a little bit of a carrier oil. And that was it. No steroids, no antibiotics, and nothing. And she called me 2 days later. She was ecstatic. She goes, for the last 2 nights, ever since I saw you, Molly is not scratching through the night. She still scratches, but at least I don't have to take my sleeping pills anymore. And I said, well, that's wonderful, Carol. And so over the next couple months, we tweaked a few things, added some more essential oils, added a few more supplements. And that dog lived to be, I want to say 14 and a half, and she never had another episode of scratching. So that was one of the best stories, I guess.
Yeah, that's
Um,
fantastic. So do you think that it was just too many things and then the body was overwhelmed, or maybe a combination of too many things and not the right things?
that could very well be because a lot of times more is not good.
More is not more.
Yeah. Not, more is not good,
More is not
always
better.
good.
Yeah,
Yeah, and sometimes you'll get, especially with vitamins and minerals, you can get an imbalance if there's too much of this and not enough of that. So making it simple, and then you like my whole thing is my whole philosophy is you can start small, you can always add, you can always subtract, but you can't just throw everything in the kitchen sink, at that dog.
I really worry about some of the Facebook groups that are out there that are not well controlled by a moderator to say, wait a minute, we're not going we're not going down that path. Because a dog mama will go in and say, my dog has allergies, right? Just that simple. What do you guys recommend? And 17 people will make 40 different suggestions and then they try them all. And
Oh,
like
yeah.
that may not be right for your dog. If nobody has stepped back and said, let's look at the whole picture, let's look at your animal and how we got here, then what you're choosing might not even be almost right.
Right, exactly. And I am on one of those Facebook groups. And even though the moderators have great hearts and they're wanting to do the right thing, they're using AI to search for the products that would help a particular condition. So it's kind of like it's just a one size fits all. It's not a customized protocol. And I can't stress enough what works for you might not work for me or vice versa.
Right.
So we have to look at the animal as an individual and not just a cookie cutter type of protocol.
Facebook is not, it's not where you need to go to get answers.
Right. And I worry about harm
Where
to
we
the
went to share a recipe or see what you had for dinner last night or your last
right.
one. But now
Yeah, and
on
and
this,
and I see a lot of people making medical advice on there, and if you're not professionally trained, you can cause some harm.
exactly, exactly. So
Yeah.
very cautious. Um, we'll get, my question for you is, one of the things that I see sometimes is when when a pet parent has like this thing in mind of what they should do, or their vet has told them, I don't know what else to do, go home, right? That it is somehow associated with the pet parent mindset. What I mean by that is, if they don't you mentioned the word trust a while ago. Carol, if
Mhm.
you trust me, we're gonna quit all of this stuff, which is sometimes very hard. But comment, if you can, on the ability for the pet parent to believe in the path that they're on.
Well, I think it's really important as any kind of practitioner that you have a personal relationship with the pet parent. In
Mhm.
other words, well, here's a good example. I just had somebody sign up for a consultation online. I have no idea what kind of pet he has, what his issues are. He just bought. And so I'm trying to get in contact with him. Now, in that situation, he has probably very little trust in me, except for maybe he's heard from me about somebody else. But a lot of my really good long-standing clients, I'm checking in with them. I'm going to say, hey, follow me on my Facebook group, do this or do that. But I will offer to talk to them, to get to know them and see if I'm a good fit to work with them. It doesn't happen often, but I've had a few people that I know I can't help because probably they are not going to be as compliant as they need to be, or maybe the pet is just too far gone.
Yeah.
And then I can't take their money. So you establish trust over time with communication.
Yeah.
And I can say that almost all of my consulting clients now, I could walk up, give a big hug to them and say, I'm so glad to meet you in person. You know what I mean? It's
Mhm.
a lot of these people I've never met, but I feel like they're my friends and they feel like they can confide in me in a lot of other things.
Yeah,
So,
a relationship's a big deal for sure. But
mhm.
don't you also think they need to believe in the modality?
Oh,
Like
yeah. Oh,
into
yes.
instead of, I don't know about this. This seems like kind of, or they're like really putting up an invisible wall or an internal wall that says, well, I'll try it, but I don't think it's going to work, that it probably won't.
Right. Exactly. And I do have a few people, and I'm not picking on anyone in general. I'm just saying this is human nature.
Mhm.
They start to, you make a protocol for them and they start on the protocol and then they start to second guess it rather than, I mean, if we had a conversation about that particular product and I could explain, hey, this is why we're doing this as a reminder because they already know why they're doing this. But they'll maybe get on a Facebook group like you mentioned, or they'll talk to some of their friends and then they're questioning the protocol.
Mhm.
And I think that here again, going back to trust, having a viable relationship is so important. Also, I do run into pet parents where their veterinarian has told them, essential oils are harmful, or a homemade diet, a raw diet is harmful because of all the bacterial contamination and whatnot. And then, it's a back and forth it's a back and forth conversation, exchange of ideas and questions. So I hope that makes sense.
It does. I mean, I think you have to have a little faith in the alternatives. And
Yes.
sometimes there is resistance to that. And it either comes from your vet or your community. We're going, oh, girl, you getting into some voodoo kind of stuff. And it's not, right? I mean,
Right.
God gave us these plants, let's use them, or the
Exactly.
homeopathies, or whatever it is. And I think people sometimes resist that. I even see them sometimes resist the food change.
Yes.
And then, I can put down anything in front of my dog and she's going to eat it. But then I have these, and sometimes I do understand why we need to troubleshoot and figure that out. But people are like, he won't touch it. He's not going to eat it. And I think some of that is we're coming in with the wrong energy,
Yeah.
giving these things to our dogs, and therefore the dog feeds off of that energy, and the things really are not going to work if we're not
I,
sort of bought into it.
I totally agree. They're mirrors of us. And you said if your energy is not good, your pet is going to pick up on that. So it's very good point.
Yeah. All right. What else you got?
Oh, well, I still have this client to this day, as a consulting client. Her dog's name is Lucy. Lucy is a 14 and a half year old Labrador. She was a rescue from Louisiana. She tested negative for heartworm before she left Louisiana. She was on heart guard at that time. And then when she got into Iowa, her vet said, it came up time for her heartworm test again, I guess, or maybe the rescue had said, make sure you test her when you get to Iowa. And I don't know why, but anyway, her veterinarian at that time tested her and Lucy was positive for heartworms. Very asymptomatic, maybe just a little bit of a harsh cough when she exercised heavily, but no other symptoms. And so the vet said, well, maybe this is a false positive. Let's retest in a few weeks. So I think they waited 3 or 4 weeks, tested her again. She was still positive. And at this time, they did some chest x-rays and her right atria was slightly enlarged. So they said, well, let's go ahead and treat her with the really strong drugs.
Mhm.
Well, my client was like, oh, heck no, we're not doing that. She consulted me and said, she was in my essential oils organization. And she said, is there anything we can do with the supplements and the oils? I said, we can sure try. And she wanted to try the slow kill method rather than doing the harsh in the muscle type of injections along the spine that is typically done in a traditional vet's office. And I told her, I said, this is going to take months. This is not going to be an overnight fix. She says, I'm fine with that. I'm perfectly fine. I just don't want the conventional treatment. So with essential oils and essential oil infused supplements, and it's been a long time, so I'd have to get the protocol out. We did, Dana, in the very first, did 2 weeks of doxycycline to kill off the parasite that lives inside the heartworm larva. And that
Right.
is, you have to do that. And so that's the only conventional treatment she got. In 6 months, she still was tested positive for heartworms, but 9 months after starting the protocol, she was completely clear and no symptoms, no, from the die-off of the heartworm, she had no symptoms. We never restricted her exercise, let her be a dog. And now she's 14 and a half. She's had a splenic tumor, a tumor on her spleen removed. And now we are working with her digestion as she's aging. She's just not doing as well, but she still chases the laser. She's a laser freak and she plays like a puppy. So, I mean, what more could you ask? But it was kind of cool because a lot of people think they have to do the chemical treatment for heartworm reversal, and that's absolutely not true.
Yeah, absolutely not true.
Yeah.
Yeah.
Can do it. It takes time, it takes diligence and owner compliance, but it can be done.
Mhm. And that's one of the times where, like, if you're working with them in telemedicine, they need their vet to do that testing.
Correct.
And their vet, or probably more likely the vet tech, is going to give them a whole bunch of grief for not
Hmm.
just doing the traditional protocol.
Right.
Be prepared for that, right? But there are
And
methods that work.
absolutely, absolutely. And
Yeah.
then, like I said, Lucy didn't have to be restricted on her exercise because it was a slow process. The
Mhm.
reason you have to restrict exercise when dogs are being treated is because the worms die off in such a big number all at one time. It can cause an obstruction in
Right.
the vessels of the heart.
Right. Yeah.
Yeah.
Heartworms
So
are bad news, right?
they
I
are.
heartworms is a do nothing disease, even in the prevention phase. But I
Mhm.
think traditional methods have people doing too much.
Right. Exactly.
So awesome. Great. Do you have others?
Of course.
We got a few
All
minutes.
right, so this is a little bit less dramatic than some of the cases I've already discussed, but this dog's name is Lacey, and Lacey had what we call a lick granuloma on her foot. And a lick granuloma basically is a fancy term for a sore that develops from excessive licking or chewing. Now, that excessive licking and chewing can come from an arthritic joint that's bothering them, and that's their way of trying to comfort themselves and get the discomfort away by licking and chewing. Or sometimes they'll have, just an allergy in that area, and it becomes an obsessive type of behavior, obsessive compulsive behavior. And I've seen dogs, the worst case I ever saw was a dog that licked completely down to the tendons.
I've seen that in a Great Dane. It
Oh,
was
gosh.
horrible.
Yeah. And so the typical treatment is antibiotics and steroids. And sometimes the antibiotic treatment goes on for 6 months.
Mm,
And
which
then
is
when,
not their stomach.
oh my gosh, 6 days of antibiotics, I think is plenty for any infection, but that's just my personal opinion. But 6 months, yes, you're going to destroy the entire gut and you'll have no immune system left. Anyway, so I looked at the lick granuloma and I told these people, I said, well, here's what we need to do. I'd never met them before, so I didn't have a great personal relationship with them yet, even though they lived just a few miles away. And the owner was like, well, I'll do anything. And my daughter's going to be home from college for the summer. So she's very diligent. Because I said, what I'm going to do, what I'm going to have you do is going to take daily applications.
Right.
So I made them just a basic, simple essential oil mixture with a carrier oil. And they said, this needs to go on this wound 4 times a day. And I said, this may take some time, but it will take care of it, but you have to make sure it's done as directed. He says, I guarantee you, my daughter's, this is her heart dog. She'll take care of him. I said, okay, great. I said, let me know. I want to call in 3 weeks because I didn't have his cell phone at the time. I said, give me a call in 3 weeks and let me know, how this wound is doing. Well, I never heard from him. So
Oh, no.
I'm thinking the worst, he didn't get better and he was upset.
Gave up. Yeah.
whatnot.
Mhm.
So I saw him at the local gas station. We live in a really tiny town here. So, even though we're not in the town, everybody kind of, in town, out of town, it's all the same, right?
Right.
I met him at the local gas station and this is several months later. And I said, hey, Eric, how did Lacey's foot come out? She goes, oh, that thing cleared up within a couple weeks. It was just fantastic. I went, oh, well, great. And I didn't tell him you were supposed to call me. I didn't want to get teased like that. But it was kind of cool. And no antibiotics, no steroids, just essential oils. So it was way cool.
Yeah, that is cool. It's amazing. I have seen in the animal groups that I'm in, and you're part of those, it's like some amazing recoveries with essential oils. Just absolute amazing. And it's
Right. Yeah.
astounding. I mean, I've seen horse legs just cut down to the bone, and people are like, there's no coming back from that. That's not, and then they do. Right? They
Right.
do. So I think it's awesome. Everybody
Yeah.
needs essential oils. Everybody. So
Well, the Dana, the cool thing about the oils, and this is mainly for your listeners here, but essential oils hit all parts of that physical, mental, and spiritual entity. They don't just work physically, they don't work just emotionally, they hit everything. And so an essential oil can have 150 constituents in it that do different ththings, or sometimes they do the same things. So oftentimes there might be a condition that gets better that you're not even trying to treat. And it's because you've used those oils for something else and it's helping, you know what I mean?
well,
So,
and I've seen too, where, and I tell people this, I'm like, especially if there's an emotional issue, right?
mhm,
Um, that the physical issue we're seeing may have an emotional root,
correct. Right.
right? And that as we start working on the physical thing, we may peel back a couple of layers that you didn't expect to see. And now we need to, but the good news is we're exposing that and we can do something about it.
Well,
So
classic example of that is, and I've seen this several times over my 31 years of practice. You have a dog that's been hit by a car and they have a broken leg. Maybe they break it at the stifle or they break it at the carpus or whatever. Several years later, a bone tumor develops, so they have bone cancer. To me, that emotional trauma was not taken care of. It was not released. And the body will store emotional baggage in different places,
right.
whether it's the liver, the heart, the lungs, bones, or whatever. So this is where essential oils shine, is if they had used a blend, and there are a couple blends that come to my mind for trauma, then that oil blend works to release that emotional trauma that the animal experienced from that injury. If that makes sense.
It makes total sense to me. And I want it to make sense to everybody who's listening to you right now. Because a lot of times we will have an injury and traditional approaches treat the injury only, not the whole animal or the whole
Correct.
human for that matter. And I even know that the human can hold on to trauma on the dog's behalf or their own trauma that the dog now takes on.
Right.
So you and I can't diagnose humans. I can't diagnose anybody, but we, I'm a lot of times I'm sitting in a conversation with the human and I want to say, is this your issue? Do you feel this way? Right.
Right.
Because as you said earlier, the dog is our mirror and they're here to teach us something, to
They
show
are.
us something, and it may be about our own issues.
Yes, very much so. Very much so. Well, I have a final case I want to give, a little heads up on this. I'm trying to pick different conditions. So this one was chipper, little dachshund, and I know you have a little dachshund
Oh,
yourself.
yeah.
And they are, for your listeners' benefit, they are very prone to a condition called intervertebral disc disease, meaning that they have a slip disc in their back and they can become paralyzed.
Right.
So little Chipper, I want to say he was 6 or 7 at the time that I first saw him. I was working at a mixed animal practice in another town about 20 minutes from where I live now. And Chipper came to me paralyzed. He was down. He had no bladder, no poop control. He couldn't pee on his or poop on his own.
Oh,
And
wow.
yeah, and he had taken a fall or a slip. I can't remember what the whole situation was, but he twisted his back, slipped that disc, and then came to me. He still had, the most important thing about this case was he still had deep pain reflex, meaning that if I took a little bit of a tweezer or a forceps and pinched between his toes, he still reeled back, pulled his leg back. If he had no reflex, that would have been a death sentence for him.
Oh, no.
And in really severe cases, when you have a really severe injury, the inflammation tends to go upward in the spinal canal, the spinal cord, I should say, and then it can cause respiratory failure. Fortunately, I've never seen a case that bad, but it can happen. So I was really adamant about getting Chipper to Iowa State University for emergency decompression surgery. And that is where they will take that damaged disc material out, clean it up, and then sew him back up and let him heal on his own. So I called Iowa State left the exam room to call Iowa State to find out what it was going to cost. And this was, gosh, back in the early 2000s, I believe. No, I'm sorry, this was 2008. And I called, and they gave me a quote of $5,000 at that time. So I imagine it's more like a $15,000 procedure now. I'm not sure, but I know that
Mercy.
it's, pardon?
I said, mercy.
Yeah. And Tammy was my client. And when I came back in, I said, well, I just talked to Dr. So-and-so from Iowa State, and they quoted you $5,000 for surgery. She burst into tears and she goes, Barb, I just can't do it. Jeremy's still in school. He went to electrician school and she was pregnant with her first child. She said, we don't financially, emotionally, I just can't do it. And I let her, you know, cry it out a little bit. And I said, well, Tammy, I said, the only other thing I have to offer you is to hospitalize Chipper, and then we'll do some essential oil therapy. He will need some conventional medicine. And here's where integrative medicine comes into play. Integrative means we're using conventional medication as well as natural medication. But I said, we've got to get that inflammation out of that back so he doesn't get any worse. She said, okay, I'll keep him in the hospital here. And I was just expecting, to keep him there for a week because we had to limit his movement too. We didn't want him walking on his front legs and dragging his back and causing more injury. So we put him in a cage for his size. And I gave him the dexamethasone injection, some other anti-inflammatory medication. And then, guess what we did? We did oil treatments on him twice a day. And this was called a raindrop technique, where we're taking a specific sequence of essential oils and dripping them onto his back, and then doing some massage therapy, very gentle massage to work the oils closer to the skin and into the spine. So we did that for 2 days. And at the end of 2 days, Chipper was able to urinate on his own. So he could stand long enough to urinate, didn't have to express his bladder anymore. And by day 4, he was up, eating, drinking, standing in his cage. Of course, we didn't let him out, but he was able to stand without collapsing. And at that point, I called Tammy and I said, you know what, Chipper's doing so well, I'm going to send you home. And she was an essential oil user too. So that's always a plus because she understood the power of them. And I told her which oils to apply at home. And then Chipper continued to improve. And he had one relapse, I want to say 2 years later, where he stumbled down a couple steps at the home, injured his back, but Tammy got the oils on him right away and he was fine. And he lived to be almost 15 and died of unrelated causes. So
That's amazing.
Yeah, I mean, she saved not only thousands of dollars, but the heartache and the post-care that it would have taken him, or post-surgical care that he would have had. So,
Mhm.
yeah, those are my most amazing stories, and I have a lot of them, but yeah, those are the
Well,
best.
make a list and in a few months we'll do another success story. I mean, I think
Okay.
I love that we do the what to do for IBD or what to do for leaky gut. I mean, I think those are wonderful conversations because people like those specifics, but I love these success stories.
Right.
This
Me
is
too.
fantastic. Thank you.
And I was going to say just to wrap up this, Dana, sometimes success means different than full recovery.
That's right.
So, for example, if I have a terminally ill patient that comes, and I had one recently where this dog developed this insulinoma, which is a tumor on the pancreas that secretes too much insulin, and then the dogs go into hypoglycemic episodes. It also had a large mass in its abdomen, so it had already metastasized. Her vets told her you might as well just put him down because, there's nothing we can do. But she wanted some quality time with him yet, and she contacted me to see if that was even possible. And I said, well, it's always possible. So she got, I want to say, 6 good months out of this. It was a Springer Spaniel, 12 and a half years of age. She got 6 more good months with him until the tumor got so big it was causing him pain. And then he was having, he didn't have seizures, but he had episodes where blood sugar got so low that it was happening all the time. He had no quality of life anymore. And then she made a decision to euthanize.
Mhm.
So her success with this case was I got 6 more really good months with my dog. And it
Right.
gave her closure. It gave her time to accept the inevitable.
Yeah. So, Dr. Barb, I'm going to change subjects and then we'll wrap this up. But one of the things that I've been hearing more about lately, and a friend of mine told me about it from her own dog's health issue. Her dog has kidney disease and there's been 18 months from diagnosis to current, and the levels have gone from stage 4 down to stage 2 levels at this point. But she's been doing Chinese herbs and homeopathics and acupuncture and chiro and essential oils and all the things, right? So she's into this integrative and holistic approach as much as anybody would ever be. But she started talking to me about something that her therapist called anticipatory grief.
I've heard of that. In fact, I talked at the AHVMA conference last year on this topic.
Yeah. So
Mhm.
maybe we'll talk about that
Okay.
in a future presentation, and I'll bring Angela because she's important to her.
Okay.
But as you think about that pet parent who it may be 2 months, it might be 6 months, and what is the quality during that time? Because I believe our pets do let us know when
Mhm.
it's time. If we're truly listening, they will let us know.
Yes,
um Rather than dwelling on the grief of what's coming, focus on today as much as
correct.
you can.
Hmm.
Don't dwell. Angela's like, we're going to do all the things, and if she wants a pup cup, I'm giving her a pup cup at this point.
Right?
She said, I know that's not on the plan, but we're doing it anyway.
Why not? Right?
Just, you can't just give up. You have to live and enjoy and then do the very best you can, whatever that is. But know that if you haven't sought other options from what traditional medicine may say, that there's at least a phone call to be made to say, is there something else we can try?
Absolutely. Absolutely. Like you said, the animals will let us know if we are aware and we're communicating with them. You look at their eyes, you can read their face, you can read their body language. And I tend to be very empathetic, so I can feel things from the animals. And I know that some animals will stay around a lot longer than they actually were intended to be here because the pet parent is still too attached.
Right. And I've even said to pet parents before, you're not hiding anything from your animal. You're not hiding any of your emotions or any of your anxiety or any of your thoughts. So
Yeah.
just sit down and have a conversation with them. It can be a meditative type conversation, but say, we're in this together, or if you're ready, then I'm going to be okay, that kind of conversation. And that's what's
Absolutely.
hard to do for some.
Right, because telepathically they know.
They
They
know.
may not understand our actual words, but they understand our energy.
Right.
Mm.
Well, this is my favorite one we've done yet.
I think mine too.
Awesome. Well, thank you so much, and we'll get you on the next schedule.
All right. Thank you, Dana.
Do you want to tell people how they can reach you?
Oh, yes, please. You can reach me at my email, which is drbfox@yahoo.com.
Okay.
And again, it's dr, like doctor, B as in boy, FOX@yahoo.com. And if you want to just tell me a little bit, if you heard about this show, Dana and I would love to know that you were on the show. And if you want more information, I offer introductory calls, just to see if we're a good fit to work together. And, we can talk about the various consultation packages that I offer. So thank you.
Your Facebook page?
Facebook page. Oh, I've got a new one, Dana, and I
Oh,
want
you do?
everybody. Yes, it's called Prepared and Empowered Pet Parents.
That's a
And
group, right? That they
it's a
can.
private group, but you just have to answer a few questions to be allowed in. And yeah, otherwise my other professional Facebook page is, I can't even remember it now.
I'll add the link.
Yeah, I think it's Dr. Barb Fox, author, speaker, consultant, but I don't post much on there because the Prepared and Empowered Pet Parents page is where I focus about 90% of my posts. And there's some really good information in there. So guys, join it. It's great.
Awesome. Thank you so much.
Thank you, Dina.
Thanks for listening to Dog Splaining. We know you've got a lot of choices when it comes to dog advice. We appreciate you trusting us to keep it honest and helpful.
If today's episode helped you understand your dog's needs more clearly, share it with someone who may also need to hear it. And don't forget to follow or subscribe wherever you get your podcasts.
For more resources, visit us online or join the conversation in our community. We'll be back soon with more insight into your dog's behavior, health, and wellness. Questions welcome, and we love guests.
Until then, keep listening to Dog Splaining.
Excellent.